Right now, there's no therapies that we know of that slow the disease. There's some treatments that help the symptoms a little bit, but there are actually very large clinical trials going on now or are about to start that are targeting some of the main elements that make up the pathology of the disease. So for example, there's immunotherapies that are antibodies to the proteins that build up in the brain, such as the amyloid beta peptide, that are quite far along. Some of them are in phase 3 trials. Some finished phase 3 and didn't work, but have been altered to look at earlier in disease or other, as well as new drugs, new biological therapies. And then there's also new immunotherapies in development for some of the other targets for the disease, such as tau is one of the other proteins that accumulates. It's been around probably as long as humans have been around, if people lived long enough to get it. But the understanding of the disease from the scientific level really didn't start to emerge until around after 1985. So it's not that new, actually. The last 20 years or so, the science of the disease has really emerged, and I think we don't have a perfect understanding, but we have a very good understanding now of the disease. What's exciting about that science of that is that there are some observational studies of families that have the gene mutations that cause that disease that are both in the country of Colombia, where there's one study, as well as the Washington University coordinates a site that's a worldwide study of dominantly inherited Alzheimer's disease. And not only is that a observational trial, but it's a part of that trial has become a treatment trial. So some of the newest medications that are being developed are being tested in subjects with those mutations even before they're symptomatic. Having difficulty with memory and thinking that is a change from the way the person was before is the most important thing. It's not necessarily just taking a test. The question is, if you know somebody for years of time and that person's function is changing, that's a clue. So certainly repeating oneself is not normal if that starts to change, or if somebody starts having trouble with their language ability to understand or speak, get words out, getting lost, those kind of things. If that's a change from the person's baseline, those are all signs that a disease is occurring as opposed to just normal aging. It's possible that some of the treatments being developed will work to some extent in people that already are symptomatic, but I think the best chance we have to really treat this disease is to diagnose it pre-symptomatically, which is possible now. We already have good methods to do it. So in order to do that, though, you have to still build those methods into clinical trials. You can't just go around screening people if there's no reason to screen them. But if they're screened and put in a clinical trial, then that's possible and is already being done now, actually.